My name is Nivashini Narsiah, and I look after technology consulting for health and public sector at Accenture, and will share with you today the digital health technology vision for 2017. For the third year, we at Accenture have conducted a global survey of more than 5,400 business and IT executives in 31 countries to understand their perspectives on the impact of technology in business and to identify their technology strategy and priority investments for the next few years. This survey was fielded from November 2016 through January 2017. This resulted in the identification of 5 trends that demonstrate that while technology is all around us, we as people are at the center. It's no longer people who are adapting to technology. Rather, technology needs to adapt to us. As technology becomes more sophisticated, it is not technology that is driving change. Ultimately, it's us as humans. We put technology to work to disrupt ourselves. The future is about creating healthcare technology for people, where technology is designed for humans, by humans, to create positive change that can transform public and private sector and society. Listening to the discussions over the last day, there are certainly many challenges that face our country from a healthcare perspective, with patients having to wait in long queues, travel vast distances, or wait weeks for treatments or medical procedures, skills shortages, infrastructure, connectivity, to name a few. However, one thing we all agree on, which was clearly evident from yesterday's discussions, is that technology innovations have the potential to change the lives of millions of people for solving for some of these challenges. What was pleasing to note that in respect of the 5 trends that I will talk through, the speakers touched on most of them. We heard about AI and robotics, about the importance of stakeholders and partnerships, about the use of mobile platforms to increase access to healthcare, and about UX and designing for humans. So as a collective, some of the trends are already top of mind, which bodes well for our country if we can execute on these and ensure that positive healthcare transformation becomes a reality. I will now discuss each of the 5 trends, which for me translates to a summary of most of the content that was discussed yesterday. Okay, so the first trend is AI is the new UI. So healthcare experience above all. Artificial intelligence is moving beyond a back-end tool for healthcare enterprise to the forefront of consumer and clinician experience. Robots are working alongside people. Smart machines are performing triage to augment clinician decision-making. AI is taking on more sophisticated roles with the potential to make technology interfaces both simple and smart, setting a high bar for how future interactions work. Can robots take over doctors? Well, let's think about this. How often do you let Google be your doctor? Well, perhaps not completely, but in a country where there are a shortage of medical practitioners, supplementing our healthcare workforce with robots and smart machines can mean faster turnaround time for patients. AI can help to address the unmet clinical demand. AI in healthcare is buzzing, with applications such as robot-assisted surgery, virtual nursing assistants, administrative workflow assistants, diagnosis, cybersecurity, connected machines, automated image diagnosis. AI represents a significant opportunity for both industry players and governments to unleash improvements in cost, quality, and access. So the next trend that I'm going to discuss is trend 2, which is ecosystem power plays. Healthcare enterprises are increasingly integrating their core business functionalities with third parties and their platforms. Platforms provide the connected infrastructure that enables service providers and consumers to exchange value. In addition to platforms, healthcare enterprises also need rich and robust portfolio of digital partners to form their future business ecosystems. 90% of health executives that we surveyed believe that it's critical to adopt a platform-based business model and engage in ecosystems with digital partners in order for future business growth. Healthcare organizations have began to realize that healthcare should be organized around the patient and not the enterprise. Therefore, currently fragmented ecosystem partners should figure out how to work together to meet rising expectation. Historically, independent entities such as hospitals and doctors focused on the functions within their control. Now, ecosystem players realize they are in many ways dependent on those who provide services before and after they do, independent of physical location. New opportunities for collaboration are giving rise to non-traditional partnerships. Major health systems are joining forces with consumer technology companies to receive breaking news alerts about patients. Providers are working with mobile application providers to create app stores of evidence-based applications. Telemedicine startups are working with major health systems to build platforms that can help solve clinical and administrative challenges. Life sciences giants, pharmacy benefit managers, and technology companies are collaborating to meet the needs of the underinsured. So, ecosystem is very much at play. Healthcare enterprises can integrate their core functionality with digital platforms through application programming interfaces, making it easier for all to plug in and to play in the broader ecosystem, facilitating patient-centered healthcare. Trend 3 is workforce marketplace. The people we need to work with are everywhere in the world, and now we can reach them and find them and get the best out of them. Healthcare's digital leaders are beginning to shape strategies to fundamentally reinvent their workforces. Driven by a surge in on-demand labor platforms and online work management solutions, legacy models and hierarchies are starting to dissolve and be replaced with open talent marketplaces. In addition to the back office, workforce marketplaces are emerging in select areas of care delivery, where open talent platforms connect providers and consumers while confirming regulatory compliance and quality. And the dynamics of the workforce market is also changing. We are having the introduction of the millennials into the workforce market, who have a very different perspective of how they want to work and how they want to engage, and the type of technology tools that they require in order to do their work. We're moving towards a very much liquid workforce, which healthcare needs to consider going forward. The third concept is around design for humans. The new digital experience is around technology that's specifically designed for humans. Health leaders recognize that as technology shrinks, the gap between effective human and machine cooperation, accounting for unique human behavior, expands not only the quality of experience, but also the effectiveness of technology solutions. This shift is transforming traditional personalized relationships into something more valuable, partnerships that span beyond physical lifestyle or care setting. Healthcare is yet another industry that is using design thinking to create tech-enabled services that are simple, intuitive, and make it easy for people to achieve an outcome. What began as telemedicine has evolved into a broad array of digital healthcare services. For starters, people can book appointments on their own. The options will only expand as technology interfaces become more sophisticated and offer more choices. What type of appointment? During or after hours? Virtual consult or in person? See the doctor now or communicate later? Even payment for care will be simpler as more plans allow you to pay for healthcare services online using a variety of payment methods. Healthcare organizations will be able to design service around spoken and unspoken needs, because human-centered design has problem solving at its core. Smart technology is always watching and learning every interaction. Through observation, systems will develop a keener understanding of what people want and what people need. For consumers, it makes self-care easier. Digital therapeutics is a good example. The technology understands a person's unique condition or disease and can customize interactions based on behavioral economics to provide nudges to take medications, schedule follow-up visits, or modify diet. In current form, the often poor usability of technology for clinicians is a considerable factor in physician burnout. The future is an exciting new frontier for experiences, all about ensuring that we as humans drive what we want from technology. The last trend, which is trend 5, is around the uncharted. The technologies that we have been talking about over the last day or so are going to create problems that we don't understand or we don't have answers to right now, but we will figure them out. But we must be prepared to develop the businesses while we recognize that the problems that rise are novel to our society and figure out how to solve them at the same time. So I think the uncharted is really about being brave enough in order to embrace new technologies and to identify how they can help us solve for the challenges that we face. The entire future of healthcare's digitally enabled transformation is in many ways uncharted. But to set the industry on the right course, healthcare organizations must take responsibility for shaping the future and moving from becoming a market taker to a market shaper, defining the rules, establishing the governance, and determining how to protect all participants in the ecosystem to shape the healthcare ecosystem of the future. By working collaboratively with regulators, standard bodies, and other ecosystem stakeholders, successful progress into the uncharted is possible. Healthcare technology is advancing quickly as cloud, artificial intelligence, mobility, Internet of Health, and blockchain emerge to transform care delivery and health administration. Consumer and clinician expectations are also changing at a rapid pace alongside technology change, creating a perfect storm of healthcare transformation. However, many regulatory frameworks have not evolved at the same speed. Standards and policies aligned to digital technology used in healthcare will need to start adapting along with new care and reimbursement models. Other industries are recognizing this, and for example, financial services has been a long industry leader in adapting standards as technology changes. Healthcare also needs to do the same. Industry leaders, government, and consortiums will need to create new rules and regulations that strike the right balance between security, privacy, and trust amid the high stakes of healthcare. Thank you.
I'm not sure if there are any questions, but it's certainly what you've highlighted is absolutely fascinating, because you've kind of set the tone and the agenda for today, highlighting all these key issues that healthcare is faced with in order for it to move forward. From a regulatory point of view, can I ask you, with the research that you guys have been doing at Accenture, how does South Africa compare to the rest of the world? Do we have less hurdles than other countries, or are we making it more difficult in this country compared to the rest of the world?
I think we definitely don't have less hurdles, because I think a lot of regulations sits with government, and sometimes the pace of regulatory changes is the biggest issue, right?
Yeah.
So I think, and that's the same that we find in lots of the other countries where we do work. I mean, if you look at regulations around security and privacy, etc., which has a big impact on healthcare, specifically because of the data that these systems need to have. But I think it's generally the same, and it's not about not understanding the need for change, it's the pace of change that is usually the hurdle.
Okay, so are you saying that we're a little bit behind the pace in this country?
Yeah.
Okay, right. And if you have any questions, we're putting you on the spot over here. We're going to put the speakers on the spot, but I think you're an expert in your field, and you've got such an interesting insight into the issues. We've got two questions, actually. Yes, sir.
Okay, I'm Hugo Vaughan. I'm just doing platform ecosystem consulting. Now, in the banking industry, we've got the open banking API set. Telco, we've got the TM Forum open APIs. Are we seeing an emerging set of APIs in the health sector, or is it still fragmented?
That's a great question. That's a great question. I mean, the future is about APIs, right? You don't have that in this industry. What's the story with APIs in the healthcare industry?
I think, I've seen APIs in many technology solutions, right? But thus far, it's limited to organizations and within organizations, right? So in terms of a bigger ecosystem play, I haven't seen the emergence of many healthcare APIs. So I think as ecosystems develop, okay, and as technologies start to play within the ecosystem, I think there's a great potential for APIs to develop. I think if we look at NHI going forward as an ecosystem, and all the technology that is going to be required in order to support it, there's a big play for APIs in order to connect the various players that will be part of the NHI ecosystem, for example.
Well, obviously, with a great deal of sensitivity to patient data. I mean, that's
exactly.
That's
so I think that's really important. The privacy, and I think, like you said, we're going to hear a lot about security today in terms of how we protect patient data, how we align to the POPI Act. I think that's going to become really important as well.
Okay.
With the ecosystem play and sharing.
Great stuff. We've got another question for you over here.
Just wanted to find out, you've mentioned the Internet of Health. Can you just expand a little bit, and also how it's going to play out in the Internet of Everything? How are these going to relate into each other, so to speak?
So yeah, I heard you talking about the Internet of Health. I was wondering the same thing. Is it the same as Internet of Things, or is it more focused on the health?
Okay, so I think exactly. So it's a term that we've used to relate to. It's the Internet of Things, but definitely the Internet of Health in terms of your connected devices, your patient alerts, etc. That we've used to talk about the Internet of Health.
These people from Accenture, they create their own terminologies. They invent their own term. I'm joking. Right, we've got another question over here. But it's true. I think that it's important because, the Internet of Things is becoming so overpopulated. You're looking at 20 billion devices around the world. And I think it's important to kind of put certain of the things and the technologies in silos. I know we're trying to break the silos apart, but with healthcare, it's essential because of the issues that you discussed. Good morning.
Good morning. Hi. Over the past day or so, we've been talking about lots of different bits of data all coming together. One of the key things is how we consolidate these and how we then share them. My question is, who owns that data? Is it the patient?
Great question.
Is it the hospital? Is it the referrer? Is it the medical aid? Is it who? And then who is the custodian? And who allows access? And this gets back to the point about the APIs, which someone has to give authorization.
Yes.
Now, some of you may tell I'm not originally from here. I've been here for a while, but I work with Accenture in the UK, and I know the issues of giving authority, and it's a big problem because there at one stage, the patient was effectively the owner. But if you're in ICU and you need access to an image and you can't get that from the patient, it creates problems. So my question is, who do you see as being the owner and the custodian of all this data that we're now going to bring together?
I think, if I look at it in the context of NHI, right, I think at the end of the day, government will have to be the custodian of that data, okay? And I think, I spoke about regulations as well, and I think because they own regulations, and as well in conjunction with some of the other healthcare bodies. So for me, I definitely see government as the custodian of the healthcare data, because if we look at it from a holistic perspective, I mean, all the data about a person sits with the Department of Home Affairs, right?
Your banking details, right?
Sorry?
Your banking details, right?
Yeah, I know, exactly. So I mean, but your person details do, right? Which is owned by government. Then as you move into healthcare, you'll start off by consuming the person data, but extending it in order to have healthcare data. So I think, for me, government should be the custodian of the data.
It's a very interesting debate, you know, because, I mean, maybe you should have somebody outside the industry being the custodian of your data. Like in our case, we could have Eskom. Maybe not, maybe not. Yes, sir.
Yeah, thanks. It may be an unrelated question. I'm here from Helen Joseph Hospital. One of the biggest problems we have is when patients come to the emergency room and they're being seen by the doctor, and you've got family members sitting in the visiting area, and they want to know what's happening with the patient. And there's no communication between the patient, the doctor or the nurse, and the visitor or the family member. So is there any solution whereby people waiting for patients to know what's happening to them, there can be some information being relayed back to the family members to say patient X is with Dr. Y and they're waiting for X-rays or they're going to have blood taken, so that they get data? Because sometimes I get woken up 2 a.m. in the morning to say, I don't know what's happening to my family member. You know, when you go to the bank, they tell you it will take 5 minutes for you to be seen, or you call the call center, Vodacom, or whatever, they will say it will take about 5 minutes for you. How long will it take for the patient to be seen by a doctor, or what's happening to the patient? Is there such a solution?
I think something like that, it's like what we discussed yesterday. I think it's all about the user experience and how every hospital has that. I think there's no specific definitive answer to that, you know. I mean, what immediately sprung to mind is, you know, those apps when you're sending a parcel or courier, like an Uber, and you can see where the Uber is, and then the courier company gives you an update that it's gone to this clearing center. Maybe you do something like that, you know. I don't know. It's all about the user experience. I don't think anybody's developed something that's unique.
No, right? I'm not sure if anyone in the crowd has heard of anything unique.
But it's actually a good idea. If somebody invents something like that, you know, except the sensitive parts, if somebody passes away, I mean, how do you put that in an app? You know, it's like a bit crazy. But anyway, but it's actually a great suggestion. You know, you've actually highlighted something that maybe somebody wants to come up with something like that. You enter the patient data, and the patient gives authority to 3 or 4 people to keep tracks of what their condition is at any time. But again, you know, maybe the doctors don't want to share all of that kind of thing to create unnecessary panic. I suppose there's that thing as well, you know.
And confidentiality. Right?
And confidentiality, yeah, exactly. Well, thank you so much, please. Thank you very, very much.